I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So do we still want to do roll call or wait, or I guess,
We have to do.
okay, let's do a roll call. Oh, I'm sorry. She's 12? Oh, I got it.
Freeman. Berkowitz. Costa. Dean Schlappman. Hickey.
Here.
Mitchell. Butler.
Here.
3 present.
Okay, so we don't have a quorum yet, so we're gonna pass over the approval of minutes. And we're gonna go to public comment. Is there anyone here for public comment? Public comment? We moved it to the front, trying something new. Okay, no public comment. Old business, because the fire chief is not here, and I think you wanted to give a presentation, well, I can't do this either. I was gonna make a motion to postpone.
I think you can just move it. He
All
can
right,
just move it on.
then I'm gonna move this and postpone it to next month's meeting for the CARES. The next is discussion for animal control, which will stay on here. I'm concerned about the municipalities in District 3 that have nowhere to bring the animals. I know there's 4 municipalities and at least 3 of them have already approached me, or I think there's 5 and 4 of them approached me. So that will be a continuing discussion. Other than that, I believe there's no other old business. And for new business, we have Elizabeth Bellotta from the Health Department, and she is going to, is she going to talk about her, is this a resolution or to change the ordinance? Okay.
Hello, Elizabeth Bellotta, Will County Health Department, and I am here with Amanda Musgrove. She is our program coordinator for environmental health. Sean Connors apologizes. He is unable to attend to explain the sewage ordinance. He had a death in the family. So we know that we have to come for a public hearing next month, but we thought we would bring the sewage ordinance, explain the changes to you, answer any questions. So then next month we don't have to go through it again. So we are here to just go through the ordinance. So Amanda's going to take it away. She has worked with Illinois Department of Public Health and the state's attorney to get to this version of the ordinance. When it goes red. Yeah, just wait.
Oh, I'm sorry. So many buttons to press.
No, that's fine. All right, so we did update our ordinance. The biggest change that's most obvious is probably the name change. We went from a sewage treatment and disposal to an on-site wastewater treatment, and that's just more of a terminology that's more current to today's standards. We did add a couple new definitions on page 2. We added a statement to our purpose. All of our definitions were basically updated to kind of be compliant with the state code and current terminology. Again, we compared to a lot of other counties on their ordinance and kind of pulled from them as well. Other than those changes in the front, our next biggest change would just be our fee changes at the very back.
Administrative hearing.
Oh, and then we did change terminology again. We previously called our enforcement a hearing. And state's attorney would prefer us to call it an administrative conference. So
And
that-
that's on page 18.
Yeah,
So yeah.
page 18 is when we changed that. But like I said, other than that, it's just our fee changes. We actually haven't had a fee update since 2016. So it's been a while. So compared to other counties surrounding us, our fees are still very similar to theirs. And then we work with our finance department to kind of come up with a fee analysis to make sure that our fees are still good. So.
And typically we try to review our ordinances on a periodic basis.
Yeah.
It's usually every 3 years. This one would have been renewed during COVID and then it just slipped through the cracks. So, we're here now to renew it. And then we will get on that 3-year cycle again. So.
And I see on C, there's a little stronger language to alert people to their responsibilities.
Correct,
I
yes.
appreciate that.
Yep,
Yes.
of course.
If there's any questions, if you see any questions later, just don't hesitate to call, and then we will be back for a public hearing at the next meeting. Yes,
Public hearing and recommendation.
to move it to the full board.
All righty.
All right, well,
Well, thank you very much.
thank you.
Yeah.
Thank you, Amanda.
Okay. Lori Summers from the coroner's office. We got a oh, you know what, Lori, could you hold, I'm gonna read. One of the members that is gonna be here specifically requested you, so, can you hold off just a little longer? She's coming. There's a bunch of people coming. But I just wanted to get through so we weren't waiting. Thank you, thank you. Okay, we have Deputy Chief Dan Jungles coming for next crime report concerning the Safety Act. Hi there. Hi. Oh, I'm slacking. There you go. You're good.
Do you have a question?
Oh, okay. I
The
thought
only,
you prepared
the
something.
only thing I
So-
provided were statistics from January 1st to September 24th, because I had previously given statistics before that from last year's report, so,
Yeah, it wasn't
I'm not
necessarily
quite sure what-
crime report. This was more Safety Act involved, so.
Okay.
I do have a few questions.
Yeah,
if that helps.
absolutely.
Okay, so I would like to know how you measure the success of the Safety Act in terms of reducing crime rates and promoting public safety.
well, right now, the overall crime rate from this year to last year, same reporting time, is down about 10%. And that's for crimes against persons. It's down 9.85% overall. Crimes against property down 9.33%, and crimes against society is up. But for the most part, the crimes against society that we keep statistics on, when those go up, those are usually a good thing, because that's just showing that our deputies are being proactive in making arrests by putting people in jail for drug offenses, for weapons offenses, that sort of thing. The only ones that aren't really what I wouldn't say would be good statistics would be crimes, would be like animal cruelty cases, which that falls under, because that's up quite significant this reporting period as well.
So you said crimes against society?
Yes, so like crimes against society, those would be all your drug offenses, child pornography, prostitution, weapons offenses, that sort of thing.
And I guess, a lot of times when we give these percentages and stuff, it's, makes my mind reel. What percentage is this crime against society? How much has it gone up?
Gone up, well, because that we have ramped up our child pornography cases, because that itself, regarding child pornography cases, has gone up over 700%. So that's why you're getting such a large number, is because last year we had, during the same reporting time period, we had 8 cases of child pornography cases. This year we have 71. So it's quite a leap.
See, those numbers I like, okay, because not that I like those numbers, but I like numbers because, when you say 10%, is it 10% of 10 or
Sure.
10% of 100?
Well, I supplied the report earlier, so you'll have a copy of that. That has all of the numbers. It has the amount of cases that there are and the percentages as well. So
Okay. So can you provide some specific data or examples showing how the Safety Act has improved community safety?
I cannot, no.
Okay. So have you encountered any challenges or barriers trying to fully implement the Safety Act?
The biggest barrier for us is dealing with the body cam issues, because we were kind of forward thinking when we went to the body cameras, because we had those before the Safety Act was implemented. But dealing with the amount of FOIA requests, and the amount of work that we do on a daily basis to redact those videos, to get them out to the public, to get them to the state's attorney's office, is a pretty monumental task because you have to go, especially for the FOIAs, you have to go frame by frame of each video and redact it. I'm sure within the next couple of years, there'll probably be some sort of AI program that'll assist us in lessening that. But
think it's
until
already
then,
here.
it's
I think it's already here.
well, yeah, but we don't have
You
access.
got
to
it,
Yeah.
right? So, did you get any feedback from the community regarding, the Safety Act, whether or not they like it or not, or like, have you had complaints?
That's it. We enforce the law. We don't, we're not going to, we don't have a choice of the Safety Act. It's not something that the sheriff's office.
I didn't know if you had any feedback from the community about their feelings about, how the Safety Act's working and stuff. No, it's fine. So could you take us through like when someone goes out to a call and they are, someone's reported of a crime and, the squad car goes out there and they're checking the streets and they find somebody running or something and they stop them. Like, what happens?
That's a pretty broad stroke. We respond. It depends on the call of service. It depends on the severity of the crime. It depends on all the circumstances that we know ahead of time. If we see someone running down the street and we're just driving, that doesn't necessarily mean there's a crime.
Okay, so what if somebody's crawling out of a window that's broken and you stop them? Is the Safety Act change the way you handle that person at all?
If we're sent to a call for a burglary in progress, no. I mean, the only thing that's changed in certain circumstances is if it's whether or not if it's a detainable offense or not.
So the Safety Act helps to get people, who I guess can't afford bail, right? But it also kind of speeds up the process, supposed to be less work. How does that, do they still have to go in and get fingerprinted?
Yes.
And then do they get let go or do they have to still go to court?
No, they would have to go to court.
Okay. So would it help you if you had the ability to fingerprint in the cars?
I really can't answer that. I mean, I suppose it would take a little bit less time, but you still got to take, photographs and do paperwork. In a lot of cases, doing some work in a car isn't very conducive to speeding up the process because you're in a confined space.
So all in all, as far as your experience goes, would you say that the Safety Act has been a good move for the sheriff's department? Like, has it made your jobs easier? Is it something that you guys are in favor of?
As far as the Safety Act goes, like I said, we work. Law enforcement's been evolving for decades, right? When Miranda came out, people didn't think that when we would do an interview with an offender, they wouldn't talk to us. I can speak for this myself. When I was a detective, the laws changed to where if it was a homicide suspect, it had to be recorded from start to finish. Well, we thought, that we're never going to get charges again. Now they're never going to talk to us, right? They still talk to us. So you have to evolve with the changes. It doesn't matter what the law is. If the law is on the books, that's what we have to adhere to.
So you don't feel it's been a hindrance or a benefit?
I think some of I like some of the things in this personally. And I'm not speaking on behalf of the sheriff's office, but personally, there are some things in the Safety Act I like, and there are some things I don't like. That's goes with every bill.
Well, just trying to get a feel for what the sheriff's, department's experience is.
Yeah,
with the
I mean,
Safety Act after a year of practicing or 2 years of practicing.
It's I can tell you as far as overtime, it is a budget management aspect of it as command staff. There are certain aspects of that have gone down, like our jail. We had 800 and some people in there at one time. Now we're down to 475-ish, 500. because you no longer have guys that are in jail for driving while license suspended or a simple DUI or an assault charge. Those low-level crimes aren't in our jail. It's only the violent offenders. And that's where the violent offenders need to be in jail.
So, and this might be a question for the state's attorney, not the sheriff's department, but I was just curious, do you see a lot of people not showing up at court?
I can't answer that. I'm not sure.
Okay, well, I'll ask that of the state's.
I mean, I can tell you, warrants are still getting issued because, I'm in charge of the warrants division at the sheriff's office. So we are still getting, roughly about the same amount of warrants we were before.
You mean if they don't show up at court?
Whether they show up at court or if it's a complaint warrant, either or.
So they did change that where they still issue a warrant if they don't show up. in
Oh, yeah,
court?
yeah. A judge will issue a warrant for that.
Okay.
I mean, sometimes it'll be a notice to appear and then the warrant will come after that. But, it all depends on the severity of the crime, really.
That must have been one of the changes, because I know that was a concern up front.
Yeah, the initial bill was awful. I mean, that's my opinion. But there were several trailer bills after that were written to clean up some of the language. There's still some work that needs to be done, but it is what it is.
Okay, you got our extra, I think there's one more, but we have two members here. Okay,
I
does,
believe we've hit a quorum. just-
yeah, does anyone else have any questions? Okay.
I'm just a little confused and I would like to ask you, Chair, is there some stance that the Sheriff's Department has taken over the Safety Act or not taken or lobbying that they're doing that I'm not aware of?
No, it's just that as the chair of this committee, it's our purview to oversee all the different departments. And since the Safety Act was enacted, we haven't heard from the sheriff's department on how it went. So I, as the chair, felt that it was good to have him come in here so we could ask some questions.
Okay, sounds like they're being compliant and doing what they need to do. And it's much like OMA, I follow it. I love to talk, so I probably have some issues with it, but it's not for me to change it. So thank you.
Does anyone else have a question for Deputy Chief Jungles? Okay. All right, well, thank you very much.
Yep, no problem.
Appreciate it. Do we, at this time, was everyone added to the roll? Do we have to, you can just add them, right?
I think we-
Okay.
we have done that.
Let's just move back a step real quick and get this approval of minutes for 9/4/25. Can I get a motion to approve these minutes?
So move, Mitchell.
Second.
Okay. We need to do a roll call on this one, right? Okay. Oh, geez. Sorry.
Freeman,
Yes.
Berkowitz,
Yes.
Costa, Hickey,
Yes.
Mitchell,
Yes.
Butler.
Yes.
Motion passes.
Okay, now we're gonna take a step back and go, or I guess in this case, a big leap forward. Lori Summers, we have a coroner's fatality report. Oh, boy, hang on.
On. I'm on. Are we good?
Yep.
Okay, good morning. I wanted to make sure that everybody has a book. I handed these out. This is the report that we gave you the last time. They're right here. Yeah. And then in there's two attached papers for the update on where we're at for this year. Okay,
Yeah, yeah.
she has one. Yeah. All right, so go ahead and start asking the questions because I know you have a great, Julie, there's been a question I know you've been asking. Great question. I'm glad I get to answer this and kind of clear up exactly what happened. So where do you want to start?
Why don't you answer that question?
I
Start
will.
right from there. and then we'll
So
let
if everybody
Julie,
looks at the stapled, the two loose leaf that I put together, that's highlighted for you. There was questions in regards to people from Will County that die outside of the county. That could be in a foreign country, that could be in another state, that could be in another county. My area of the county, we do not have hospitals, so they can get transported to Indiana, Kankakee, or Cook. Wherever death is pronounced is the county that does the death certificate. Okay? Once they leave the county, we're not going to get notified of that. They did not die in our county. And it kind of can reverse. You have a question. Okay. It can reverse where, Kendall County has no hospitals at all. So Morris Hospital, when someone has a traumatic brain injury, whether that's from a motor vehicle accident, a fall, if they're in a nursing home, they will get transported to St. Joe's because it's a higher level for that type of injury. Does that make sense? If they die in our county, it's my job to take care of that death certificate. And that does not mean that we go back to Kendall or Grundy or anywhere else and say, here's the information. It is where the death is called. So, Dan, can I use you for an example without offending you?
am I going to die?
When you're going to die, so to speak. So Dan gets in a motor vehicle accident on his way into the county board. They airlift him to Chicago. After Dan gets there, because of the injuries, Dan passes. It is the Cook County medical examiner's responsibility because it's where the time of death is called, that's the county that has the responsibility. Does that make sense?
Lori's looking at my face, so I'm assuming that she thinks
I know,
that-
I do the same thing. Okay.
I cannot play poker. So it's not that I don't understand that. It's just that I'm having a hard time with the idea that it's 2025. And if somebody dies in Cook County, and they're a Will County resident, that Will County is not notified.
Okay.
I have a hard time with the fact that in this computer age, that this is not given across, at least within the state. Maybe I can understand if Dan had the same accent and died in Florida or something like that, or Colorado. I'm just picking a place.
I live right next door to Indiana, so
Right.
that's out of state, but
Right.
I'm not done. So now I have an answer for you.
Okay, or maybe even within like the same like Midwestern region, maybe regional even.
Yeah.
So I'm or like say Illinois, Wisconsin, Indiana kind of thing. I'm just having a hard time with the fact that we live in a computer age and it's not.
Okay, so when we file the death certificates, which we have people that have to do that. I have a girl that does pretty much basically that. That's a girl that does this for you. Once it is filed in that county, we do not have access to look at those. You are based county by county. I cannot go in and look at Cook. I can't look at Kendall. That's not our ability. So now, say they took you to Kendall County, which kind of stinks because there's no hospitals there, Dan, but
That's why I died.
that's right. So Kendall County will file your death certificate. Cause and manner of death was related to the motor vehicle crash. It gets filed with the state, and then the state sends that to the local registrar, who is the county clerk. Okay, it does not come to my office, okay?
Yeah, and I was going to mention that. So and that is collar counties. As I recall that the last time I talked to the clerk's office, they said collar counties do that, but there still might be a case where if it's a county in Southern Illinois, it might not come up here. Is that changed or?
I do not know that. It is, again, my understanding is once that death certificate, because Dan, your family's going to bring you back to Will County to be buried. You're going to go through more than likely a Will County funeral home or crematory, whatever the choice is. They file it in their county, once it is filed with the state, everything is sent to the local registrar. We're not going to follow up with that. There may be fire and police on scene during those accidents where these people are transported out of the county. But they're not going to get a lot of the information either. And in order for that to gather, I'm not going to know about those. I'm not going to know about those.
Yeah, and I guess
So-
it goes to intent, right? Like what is the purpose of, your department issuing death certificates? Because you issue them and then you give them to the clerk, right?
No,
You
we
don't.
issue, when
I mean, they're not.
it
filed with
is
the clerk.
Will County based
Mhm,
and the person was declared deceased
mhm.
in this county, everything comes through me. So now I go through
And then-
waiting. Okay, I'm going there. Just give me 1 second. I'm waiting for all the labs to come back, medical records to come back. We're seeing if it is okay for a physician to sign it out, or if it is mine, if it's something that is not necessarily a natural death. If the person has not been to the doctor in over a year, it becomes my case, even if it is a natural death. Does that make sense? Because
Makes
they can't sign
complete
it.
sense.
So
You just
now I
understood
sign
what I
out.
was saying.
Now I sign it out with the cause and manner. It goes to Trish in my office, who then files the death certificate into IBRS, Illinois Vital Record System. That is where the death certificate is produced.
So not the clerk. That is the
It'll-
clerk. I'm just saying.
It'll come to the
I'm-
clerk.
I'm not trying to.
The clerk,
like,
no, I'm trying to
let me
explain
just
to you.
finish. I'm not trying to find any wrongdoing or anything. I'm just trying to say,
Nobody said you were.
you,
You're
Well-
good. You got a right to ask all these questions.
I don't have, I mean, this was Julie's questions. I didn't.
How you doing,
I didn't
Julie?
push it up, But
Is it a little
I
bit
was just
clearer?
trying to point something out, is that when other counties have the death certificate, it gets filed with the clerk's office.
Correct.
Just like in this county, it would get filed with the clerk's office. Everybody, so it's not like, it should be any different. And in the past, it was only this county, but then recently it had become collar counties all cooperating together.
Dollar counties, other states, and that's what happens. So I'm going to go on. So I get where you're going with this.
I'm not going.
So what? No,
anywhere.
no,
Just
no,
Trying
no,
to explain
I'm
to
trying
them,
to
like, why, that doesn't come to you. They're all going to the clerk. Like if
Correct.
they come from different counties or that. I wasn't going anywhere.
So
Trying to
as
just
the
clarify.
funeral home, that's where I was trying to go. So your family brings you back to Will County. The funeral home will now, part of your disposition or the package for you being buried or cremated is that you get death certificates. Once they're filed with the state, they get filed with the local registrar, and then we watch in Will County and notify the funeral home death certificates are ready. We don't provide those. So the funeral home then will go pick them up and distribute them to the family. It's the same thing if they're out of the county or out of state. Does that make sense? Okay.
I totally understood that. Julie?
Thank you, Chair Butler. So Lori, so I've got page 24 and 25 here. It says, for all accidental drug-related deaths, it has Naperville 1. And accidental heroin fentanyl, it has Naperville 1. So does that mean in 2024, there were 2 drug deaths in Naperville?
If you're looking, no, we do not separate the heroin from the fentanyl. There was one death, whether it was
One
heroin
death.
or fentanyl.
Okay. So I don't know that that's true. Here, that means that was the only death in Naperville from drugs in the entire year, 365
No.
days.
No, Julie, if they were declared, okay, again, we're going to use,
So.
I'll use
So
Julie
hold
this
on,
time.
let me finish. What happens in my district is that because we are right next, literally right next to DuPage,
Mhm.
there can be a suicide or a death.
That
And
gets transported here.
that is taken to a hospital in DuPage County.
Mhm.
So my question was, when that happens, when that occurs, is Will County reflecting that incident, that unfortunate incident, whether it's drugs or suicide? Is Will County reflecting that? Is that in here?
No, because they were declared deceased in another county. They are out of our county.
And,
So
okay,
that would be DuPage, like for you, you could go to the DuPage County.
so what I
Court.
would like to see is I would like that reflected in, because it is a Will County resident. So my question is how do you do that?
We go through the county clerk. That's what I was explaining.
Well, I'm asking
They're the
you,
ones-
will you do that?
If you give me another person and a half to trace it down, and that's, Julie, my people work part-time. I have 3 full-time people. And that would take, and that would be
Well,
a
I think this
huge
is an
undertaking.
IT, this is an IT issue because this is all done electronically. I mean, if they're sending you any type of records,
They're
you're,
not, if they're
you're-
taken out
they
of the
send you
county.
no records
Because they're-
regarding.
The death is declared in another county or state. No, we do not get those. That is not for us to do the investigation,
No,
they
I'm not
did-
asking for an investigation.
but that's what we would have to do. That's what
Okay.
we would have to do.
Okay. Lori, can you, after this, I
Mhm.
wanted you to make a comment regarding these new drugs that are out there. Many other communities are experiencing them. I know it's a big problem in Indiana. You mentioned fentanyl here, but I'm talking about, and I can look up the names of them.
Yes, I think
they're
that
very
that's,
difficult to say.
we actually have those on our website. Julie, I was asked to bring this, and you know what? I will come back
Okay.
next month with all that info for you. Okay?
Absolutely. Thank you.
You're welcome. What's that?
Hi, yes, I just wanted to chime in, and Corner Summers brought us this, which is the Illinois state law, and it says, that it's any county in Illinois. It doesn't matter
No.
if it's a southern county, a collar county.
No.
I don't know what other kind of counties there are, but they're all covered by this. So this is prescribed by Illinois state law. So this is coming from Springfield. So I appreciate that there are things that the coroner's office does do for us and give us things like this, which isn't necessarily prescribed by law, but I do really, really appreciate
welcome.
everything that you bring to us. Thank you.
It is.
Okay, if there are no other questions, thank you for your report.
Can I go ahead? I,
No, I just turned on real quick. I was trying to catch you. Okay, Lori.
I'm trying not to do that.
Okay, talk to me like I'm a kindergartner. So you said, just to be clear, so I understand how this process goes. Dan dies in Chicago. Sorry, Dan, you keep dying in Chicago.
And I put you in Kendall, which was closer, okay? He
Okay,
dies in
Dan
Chicago.
dies in Kendall. Kendall does the report, because
Correct.
that's what they have to do.
Correct.
And then they send it to the clerk? They send it to Will County Clerk or no?
No.
Or when Dan's
When
family
we,
comes here?
Illinois Vital Record System,
Right.
when they go in, the folks in there, I have a girl that does this.
Mhm.
Cause and manner of death, we've made a determination 2 to 3 months into this. She files it with the state. It
State.
automatically goes to the clerk's office once it's filed.
Got it.
Okay? Yes.
County of residents.
Okay, thank you.
No.
Because you're going to get the funeral homes will request those too.
Yes.
Okay.
Um,
And we let them know, or they let them know as soon as they come in. Okay.
Dan, Lori was going to comment on the xylazine and
Xylazine.
and then the other.
Julie, unfortunately, there's another, and Dr. Burke can speak to this maybe more, another opioid designer that's even more powerful than.
Right, are we
fentanyl.
seeing that here in Will County?
You know, I have to tell you, that's where I was gonna go. The rates on fentanyl and heroin and opioid overdoses are super down. We are
Okay,
seeing, we
What
are
about
seeing,
these other drugs?
everything is super down. Xylazine is a animal tranquilizer,
Mm-hmm.
and we are not seeing those currently. What we are seeing is cocaine deaths.
Okay, so there's no concern, I guess be more specific, no concern about fentanyl, it's going down, what does that mean?
It's
Give
not
us a
means
number.
that there's no
going down.
concern. There's always a concern. What that means is the programs that this wonderful county put into place are working. The Substance Initiative Program is working. Unfortunately, and I did speak to Frankie and Mark Revis about this, our suicides are going way up. Not by numbers, but how it's condensing into a shorter amount of time. So we will probably be over our numbers from last year on suicides.
So Lori, the suicides, you've ruled out the impact that had anything to do with drugs or drug overdose? That is just a
It's
that
a
is a true
suicide, and some folks do leave notes indicating that they did it with drug usage, whether that is prescribed drugs. If they leave a note, we know that. If they don't, it's still considered an accidental death as far as drug toxicities.
Okay, I still would like numbers when, when you say it's going way down and it's not,
And my
I would
numbers,
like-
actually, every time we sign out are on my website. We put them in there as soon as we're done. So
I see 2024, so there's nothing for
you,
2020. I'm on the website right now. Oh, here, hold on. Okay, thank you,
yeah,
Lori.
Doc Burke gives a lot of the reports. So I'll come back next month and give you some numbers. And actually, that's been good overall, seriously, especially with the opioids, the fentanyl and that. However, like I said, we're seeing more cocaine now, and everyone should be concerned that the suicide rate's up because there's no rhyme or reason to it. They're from young to very senior that are taking their lives. And it's happening on a weekly basis. That's why it's condensing down, not sporadic. And we can bring those back to you. But again, I want to thank them. I also want to give a shout out to our sheriff's department. Last week, I had a situation when I was driving home. I actually found a young man on the side of the road who was obviously having a mental health issue. I thought he was deceased, and only one car stopped and helped me. Our sheriffs came out and we transported him to the living room. And I bought him food because he hadn't eaten 2 days. He hadn't slept in 2 days. And one car did stop, and it's the woman from Triple H. If anyone knows who that is, she runs an equestrian farm for people who are in recovery to work with horses. She stopped. We drove him to, I gave him gas, I bought him gas station food, and the sheriff came over and drove him back into Joliet because we couldn't get him placed at Daybreak or Morningstar because they were full. And he would have been evaluated at the living room. So it took, again, people coming together and just doing it and sticking it out till we got this young man some help.
All right, well, thank you very much.
You're welcome.
We have, you have to go, you want. Oh, so you're not asking to change the schedule up any?
I would never do that.
Okay, lots of work to do, I get it. Okay, from Sunny Hill Nursing Home, Maggie McDowell. Oh, I'm sorry. Jeez. I'm a slacker.
Okay, good morning, everybody. Obviously, you would have received a copy of my report. It's basically informational. Again, just if anybody has any questions specific to any element of the report itself, I'm going to make this very brief. Unless there's specific questions about any aspect of it, I'd be happy to answer them. Otherwise, I don't have any wonderful nuggets of wisdom to share with anybody.
I just know if you'd like to kind of give a explanation, we have some new members about the holiday bazaar and the needs that you have for that.
Okay. Yes, in the there's a flyer included, and this is actually this is an annual event that we have with regards to obviously prepping for the holidays, and we're kind of looking to have a barbecue lunch, a bake sale, and the bazaar all combined in one. It's usually one of our busiest events of the year. It's very well attended, and kind of we get a jump on the holidays as well. The nice thing about it too is our residents get to participate in all of this, and they start preparing for the holidays. And this is done on an annual basis, and obviously our Friends of Sunny Hill organizes and kind of is the forerunner with this. This is not something that's new. We've been doing this for years, but I do see year by year we're getting a bigger, broader attendance at the event, which is wonderful because all those funds then go towards our residents and residents' needs.
Thank you for that.
So
And again, I just want to give a shout out. It's going to be on Friday, October the 21st, or I'm sorry, October the 24th, and it'll run from 10 a.m. in the morning until 3:30 in the afternoon.
and your needs for that?
You know what, the specific needs, this kind of we look at what, things outstanding that the residents have. Right now, the most recent budgeted item that we did was the newest carving on the lower level patio. We had a tree that was dead. We had the tree taken down, but we retained the tree trunk, which was like 10 foot tall. And they did a carving into that. I did post it on Facebook. And that was one of the items that Friends of Sunny Hill paid for. So that's like one of the smaller items. The bigger items are if we need a new bus or we need different things for residents within the facility, I bring it to that board and, they evaluate whether they will fund that or not. But, we don't have any immediate needs right now. We are looking at some upgrades to the outdoor patio areas, like maybe the sunshine patio. We're talking about getting a pricing for a new pergola and, some upgrades to actually enhance that outdoor area for the residents. So again, that's kind of a work in progress right now.
So I know last year
Very much.
I'm sorry, I know that last year I'm the vice chair and I can ask a question. No, you and I'm sorry.
Report.
They
And now we
need
have like.
baked items, am I
lengthy
correct?
Questions.
They need baked
Jim
items.
Richmond came up
Yes,
to ask a
yes,
Thank
question.
you. So if people
Thank
could
you.
bake items, please take them in. Dan, you have.
All right, Jim, would you like to, there you go.
Thank you. So Maggie,
Good morning.
how you doing?
I'm doing wonderful. Thank you.
Good, good. And those new beds are working out good?
Those new beds are working out wonderful. No
Excellent.
complaints. New mattresses too. Nothing like it.
Excellent.
Yeah.
Well, hopefully I'll never have to use one, at least if not for the next maybe 40 years or so. So,
Okay.
so I got a question for you. I have a question for you. So I was looking at your report
Yes.
and you have one page, I don't know, it looks like this.
Okay.
Okay. So I apologize if nobody knows what it is. I don't have my in front of me. But so you say current residents by city at time of placement. Okay. So that means that they were residing in that village limits before they came to you.
Correct.
So let me run a scenario by it. So fictitious, my dad lives in Madison, Wisconsin.
Yeah.
Gets elderly. I move him to a nursing home in Mokina. He's there for a couple months. A spot opens up in Sunny Hill. I move him from Mokina to Sunny Hill. Is it listed as Mokina as the place of placement, or is it Madison, Wisconsin?
This has actually come up recently where, we've had a couple of people that have said, oh, well, if we move them here, whatever the designated address for that individual is, again, if he moved on a long-term care basis to Mokina from Wisconsin,
Well, just,
and he had
just move from
lived there.
Wisconsin to Mokina, a nursing home there for 4 months.
Okay, if that's where his residence is, then we will consider that his address, and then we would admit him from there.
Okay, so it's possible then, because then it's possible then that we are bringing people in from out of the county or out of the state. They temporarily stay at and I'll just use a Mokina nursing home for 3-4 months, and then they get placed here. They end up on this first column where it says at time of placement.
Mm-hmm.
Okay. Thank you for clarifying that, because it looks like between 8 and 12% of these people are from out of our area. But then if you dig a little bit deeper into our current residents' family census, it's from farther out of state, or farther out of the county, I should say. Okay, so thank you for clarifying that. And then also too, as I know you and I spoke at the beginning of the year, we were running a negative deficit on your budget. Are you projecting that you're going to get to break even this year, or are you still going to be
At
a
this
negative?
point, without checking with my finance department, I can't give you anything definitive on that, but I can clarify that and certainly get back with you, Jim.
Okay, good. All right. Because I appreciate the fact that you took the initiative to try and capture as much revenue as possible by hiring somebody to help you with Medicare, Medicaid, private insurance, capturing as much revenue dollars as possible. How is that program working for you?
That landscape changes on a daily basis. I know that right now we are working with our accountant, but also we are going to be working with, because that's a bid that's currently in progress for a consulting agency. We are actually out to bid, and those interviews start this week with the health department. So we can take a closer look at kind of that overall landscape, because like I said, it's a minefield, and things change on a constant basis, and there's no way any one individual can kind of stay abreast of that constantly. So having a consulting company come in and actually help and assist with that process, I think will be beneficial.
Okay. Well, you said it's a minefield out there.
Mhm.
It's a minefield for every business too, that has to go through and deal with regulations and changes and the way that they have to operate in that. So when do you think you'll be able to give us a thumbs up or a thumbs down as far as we're seeing net positive revenue, incremental increases with this new program? What's your projection on that?
At this point, that would be very hard to evaluate. Certainly, I would like to determine who the company and who the consultant is, and kind of exactly more definitively what exactly they're going to offer us in what context and how that's going to pan out. At this point, I think it's very premature for me to kind of
I'm not
guesstimate
asking,
like
I'm not
what
asking for
that would
dollars
be.
and cents figure. I'm asking for a timeline. The bid is out now.
The bid is out now, and I think we anticipate getting this underway very quickly. I would imagine though that we're going to work with them for at least a year. So again, my projection would be at least a year from now.
So maybe next time this year, you might be able to have a
Yes.
good handle
Yeah.
on what.
I would
okay.
imagine so, yeah.
All right. Thank you very much.
Okay, thank you, Jim. Okay, all right, thank you.
Hello, once again, Elizabeth Bellata, Will County Health Department, with Denise Bergen, who is with the Will County Health Department also. I just wanted to mention a couple things, that October is Breast Cancer Awareness Month. So please take this time to recognize the importance of prevention and early detection and access to care. I also wanted to let you know that we did get some of the COVID vaccine in at our health department. So if anyone is interested, please call our immunizations department at 740-8143 to set up an appointment to get their vaccine. I also want to mention to someone, I believe it was brought up earlier, that the North Branch did have our open house on September 29th. It is to celebrate the expansion of our community health center and of our behavioral health suite. We had, I would think, probably around 50 people that came. We had some great speakers, including Micah Freeman on behalf of the county, and she's also a Board of Health member. Our Board of Health president, the chair of our community health center, the CEO of the community health center, the executive director of the Will County Mental Health Board, the division director for behavioral health, and of course myself. And then we provided tours and a ribbon cutting. So we also were lucky that the mayor of Bolingbrook did attend. We also had Representative Avalar and Senator Ventura that also were there, and several board members, including Ms. Berkowitz, Ms. Hickey, and El Castro was also there, including Micah. So thank you again for coming to that event. The only other thing I was going to turn it over, if you don't have any questions from my report, I did want to have Denise just mention something regarding the federal government and the budget.
So we all know the federal government, they are under a shutdown right now. And as a health department, we are funded a lot through grants, through Medicaid, through Medicare. We are not anticipating a large impact from this shutdown because these healthcare services are considered essential. So payments will continue. Now, the longer the shutdown goes, the more we could be impacted. It would just be by a delay in reimbursements. The state may be limited or delayed in their drawdowns, as will the health department. We do have a direct federal grant. We are not anticipating that we will not be able to access those funds. We will continue to draw down the funds. It would just be a matter of timing because, you know, federal employees furloughed, if it goes on for an extended period of time, the ones who are not being paid may not continue showing up. There could just be a delay in cash flow for us.
I just want to let you know that we are continuing services. There was one thing I did want to update you on West Nile virus in case you were interested. So there's 101 cases. It's been such a warm summer and into fall, and we don't have our traps out there anymore, but we continue to see cases. So there's 101 cases in the state. Right now in Will County, we have 6. And we had over 3,895 positive mosquito batches in the state. So it continues to be something. So make sure if you're out in the evening, you know, wear your long sleeves and put on your repellent. So I just wanted to remind you of that. And then hopefully, I don't know if you saw in our report under the communicable disease, I wanted to point out some of the things that our communicable disease department does do, not only following up with foodborne illnesses or some items like that, but they also followed up with a Legionella case that was related to a warehouse in Will County, and also to a investigation with rabies. So I wasn't sure if you had a chance to see that, but I just wanted to point those things out. Any other questions?
I had a question about West.
Oh, okay. Yes.
Thank you, Dan. West Nile, what are the symptoms?
So it's a flu-like symptom.
Okay.
Yes.
Now, if I go to my doctor and he determines, do they have to do a blood test to
They do,
determine? Okay.
correct.
And then let's say a patient comes in and they have West Nile, then do they notify the health department? Is that part of the process?
Correct. Yes.
Okay.
And a majority of individuals that do contract West Nile don't even show symptoms. So it's a small percentage
Okay.
that does show symptoms. But yes, we do get notified, and that's how we keep track of them. And then our CD department does
Okay.
work those cases.
And I know that can have very, very serious, and they can also be permanent. can't they?
Long-term effects, correct.
Yeah.
Nervous system.
Oh, okay. All right. Well, thank you so much. Thanks for all your advocacy on that as well.
All right. Thank you.
Appreciate it.
Thank you. If we could go to the second page of my report, I'd like to start there. Our overdose deaths are still down over 50% compared to last year. I think that's important to remember, and that data all comes from the coroner's data. Next slide, please. So Julie, you were asking about the question about suicides versus overdose deaths, and the coroner's office does track that. So in this report, I supplied that information. So you have whether it could have been identified as a suicide, it was an overdose death or an opioid overdose, and it can be identified as a suicide, then Lori counts it that way. So I knew you were interested in that information, so I thought we'd be able to provide that to you. The other question that you had was about nitazines. First of all, let me assure you that my project analyzes all the substance overdoses in Will County. So I always take a look at the tox report, the information that Julie provides, because we are monitoring for those other drugs that are showing up in other counties. We have not seen nitrazine in this county. It will respond to Narcan in the same way an opioid would. That's the good news. But we do monitor because we want to know what's in the drug flow. And we keep an eye on what's going on nationally, locally, and statewide. So many of the questions that you ask the coroner can be found in my report. But those were probably, I know it's been a long meeting, and I just wanted to point those if anybody else had any other questions.
No, I mean, it's fine. Take your time to get out whatever you need. Trying to keep things moving along so the people at the end have time, and it's not running into 2 hours, but,
No, I appreciate that.
Is it-
No, we're still booming. Our strategy is working. Our Narcan strategy has reduced deaths. If there came a point in time where we were not seeing that impact, we would adapt our strategy and we would implement other programs across the county. So I want to reinforce some confidence in the committee that we are on top of it and that we're monitoring it as closely as possible.
do we have any questions?
Every confidence in Dr.
Okay. Well, thank you very much. All right, I guess I'll give this announcement one more time. I've given this announcement the last 3 months. During the meetings, I want to follow a certain protocol. And we need to have people recognized on the floor. And when we ask questions, I want them to be concise, so not open-ended, so that we can keep things moving along. So I know if I'm a little harsh this time, it was because this has been 3 meetings in a row that I've given, and you can go back and check the minutes. But, we cover a lot of territory, so just everybody pay attention to rules. All right. Can I get a motion? We have no executive session. Can I get a motion to adjourn? Get a second? All in favor? Or is there not a quorum? So, well, I guess we could just go out anyway. Yeah. Yeah. Motion to adjourn. Approved. Next meeting is November 6th, 2025.
It's one thing you can always do, warm or not.
Yeah.
Motion to adjourn.
We can all leave.